You're looking to cut through the noise, get a real understanding of something complex without spending hours buried in research, right?
Yeah.
That's what we do here. Today, we're diving deep into a listener-provided piece all about a really serious and surprisingly common condition in dogs, gastric dilation and volvulus, or GDV.
Right, GDV.
You might know it as bloat, but believe me, that simple name doesn't even scratch the surface of what's going on.
Exactly. We've got a detailed rundown here that really gets into the mechanics of GDV, and our goal is to extract the essential information for you.
Yeah.
We're talking about what's happening inside the dog, why it's so incredibly dangerous, which furry friends are most at risk, and most importantly, what can be done.
Okay.
While it might seem like a straightforward issue or a swollen stomach, the reality is far more intricate and can have, well, devastating consequences if not addressed immediately.
Okay, let's unpack this GDV thing. So the source lays it out.
Yeah.
First, the stomach dilates. It swells up like a balloon. But then comes a really scary part. It twists around its short axis. That's the volvulus.
That's the twist, yeah.
And GDV, yeah, that's the shorthand you'll hear. But the crucial thing to understand right off the bat is this isn't just a dog who overate. That twisting action is what escalates things from uncomfortable to life-threatening.
Precisely. And what's both fascinating and a bit unsettling is that the precise trigger for this whole sequence of events remains elusive. The source emphasizes this point.
Really? So we don't actually know why it happens?
Not exactly. We know certain factors seem to play a role, but they don't always lead to GDV, which makes it a real challenge. Things we often hear about, like a large meal, gulping water, or even vigorous activity right after eating these might be contributing factors, but they aren't the definitive cause. The excerpt does mention that the twist, in the vast majority of cases, is a clockwise rotation when the dog is on its back, viewed from behind. That gives us a mental picture of the mechanics involved.
Okay, a clockwise twist. And here's where it gets really critical. It's like a chain reaction once that stomach flips.
Right. Because of the rotation, any gas and fluid that's trapped inside has nowhere to go. It's blocked at both ends.
Exactly, sealed off.
And this leads to the stomach just getting bigger and bigger, progressively distending, as the source puts it. But it's so much more than just a bad stomach ache, isn't it?
Oh, absolutely. As the stomach continues to inflate, it exerts tremendous pressure on everything surrounding it in the abdomen.
Like what kind of things?
The source specifically points to the compression of major blood vessels, the caudal vena cava, and the portal vein. These are vital for returning blood to the heart.
Okay.
When they get squeezed, the volume of blood making its way back to the heart plummets, leading to a sharp decrease in cardiac output and a condition called hypovolemic shock.
Hypovolemic shock, got it.
And from there, a cascade of very serious systemic effects can occur, including organ damage, widespread inflammation throughout the body, and even disseminated intravascular coagulation, DIC, which is a dangerous disruption of the normal blood clotting process. Wow, DIC. So it's not just the stomach suffering, it's a full-blown body crisis. The source breaks down how this impacts different systems. Let's start with the gastrointestinal system itself.
Okay.
It says the reduced blood flow can cause ischemic necrosis of the stomach tissue, essentially. Parts of the stomach start to die off due to lack of oxygen.
That's right. And because the stomach lining, the mucosa, is metabolically very active, it's particularly vulnerable to this damage. It needs a lot of blood flow.
That's a key detail. So moving on to the cardiovascular system.
Yeah, that severe drop in blood return to the heart, as we discussed, results in low blood pressure and reduced cardiac output.
Right.
This means vital organs aren't getting the oxygen they need, leading to hypoxia and potential tissue damage. What's also concerning is the increased likelihood of heart rhythm disturbances, especially premature ventricular contractions, or PVCs.
PVCs. Why does that happen?
Well, it can happen because the heart muscle itself isn't getting enough blood, and also due to the inflammatory response that's happening throughout the body.
Okay, makes sense. And the trouble doesn't stop there.
Yeah.
The source highlights that the spleen is frequently involved.
Very often, yes. It can experience a twisting of its own blood vessels, which they call avulsion of the short gastric vessels, or even a full splenic torsion where the entire spleen twists.
The whole spleen.
The whole spleen. Or infarction tissue death due to the blocked blood supply. So it's a real internal catastrophe affecting multiple organs.
It truly is. Now let's shift focus to which dogs are most susceptible to this. The source clearly states that GDV primarily affects dogs. Seems obvious, but good to state.
Right, canine specific mostly.
And when we look at breeds, the key takeaway is that those with deep chests are at the highest risk, especially the larger and giant breeds.
Definitely. Great Danes and German Shepherds are specifically mentioned as high risk.
Classic examples.
Mhm.
But what's particularly interesting, and perhaps surprising, is that the source notes GDV can rarely occur in smaller, deep-chested breeds like Dachshunds and Pekingese.
Yeah, that does challenge the common assumption that it's exclusively a problem for big dogs. It's about that chest conformation, really.
So the shape matters more than just the size sometimes. And age.
Regarding age, while it can happen at any stage of life, the risk unfortunately tends to increase as dogs get older, more common in middle-aged to older dogs.
Okay, so if you have one of these higher-risk breeds, or even just a deep-chested dog, what are the early signs, the red flags that GDV might be developing? The source gives us a list of historical findings, things an owner might observe at home.
Right, the things you'd see.
The first one is vomiting that progresses to what they call non-productive retching, or more simply, dry heaves. That sounds like a pretty specific and concerning sign.
It is, that's a big one. Other historical signs include noticeable anxious behavior, maybe pacing, restlessness,
Okay.
obvious indications of abdominal pain. They might look at their belly, groan when they lie down. And abdominal distension, though, the source makes an important point that you might not always see a visibly bloated abdomen, especially early on,
Why is that?
because the swollen stomach can be tucked up under the ribs, so it's not always obvious just by looking.
Ah, okay. Good to know.
Other things to watch for are sudden collapse, which is obviously very serious, excessive drooling or ptylism and lethargy, just a general lack of energy and enthusiasm. Not themselves.
And what might a veterinarian find during a physical examination if you rush them in?
Well, they might also observe the distended abdomen, but again, it might not be obvious visually. A rapid heart rate, or tachycardia, is a common finding,
Okay.
as is rapid or labored breathing, known as tachypnea or dyspnea. And as the signs of low blood volume, that shock setting in, become apparent, they might detect weak pulses, pale gums,
Hail gum.
and a slow capillary refill time. That's how long it takes for color to return to the gums after you press on them gently. It should be quick, like under 2 seconds. If it's slow, that's a bad sign.
Right. All of these signs together create a picture of a dog in significant distress. Now let's delve a bit deeper into the potential causes and risk factors. We've already touched on the fact that the exact cause remains unknown.
Still a bit of a puzzle, yeah.
But the source reiterates that it's likely a complex interplay of factors, including their physical makeup, anatomy, genetics, and environmental influences.
Exactly. Multifactorial is the term usually used.
Right. And it's fascinating to see how our understanding of these risk factors has evolved. We used to think that strenuous exercise immediately after eating was a major trigger, and it's still considered a factor, right?
Still something owners are advised to avoid, yes. Let them rest after meals.
And the anatomical predisposition of those deep chests in larger breeds certainly makes intuitive sense.
Definitely a big one.
But here's a really surprising piece of information. The source indicates that more recent research has actually linked eating from a raised food bowl to an increased risk.
Yes. That completely contradicts the older advice that elevated bowls were better for preventing air gulping or aerophagia.
Wow. So the advice actually flipped on that one.
It seems so, based on some studies. It really highlights how ongoing research continues to refine our understanding in veterinary medicine. It's always evolving.
What are some other risk factors mentioned?
Other factors that have been identified include having a first-degree relative with a history of GDV, a parent or sibling,
Suggesting a genetic link.
suggesting a potential genetic or familial component, yeah, even if a specific gene hasn't been pinpointed yet. Eating very quickly is another recognized risk.
Good bumulpers.
Exactly. And there might even be a connection sometimes to the presence of gastrointestinal tumors that can disrupt normal stomach function or motility.
Okay. So if a dog presents with these concerning signs, how do veterinarians differentiate GDV from other serious abdominal emergencies? Because other things can cause a swollen belly and collapse, right?
Absolutely. The source lists several differential diagnoses, other conditions that need to be ruled out.
Yeah.
Things like septic peritonitis, a nasty abdominal infection, internal bleeding, like a hemoabdomen,
Okay.
twisting of the intestines themselves, which is different from the stomach twisting, or just really severe gastroenteritis. And then there's simple food bloat,
Food bloat.
which is simply gastric dilation. The stomach stretches, but without the dangerous twisting. Usually seen in dogs who have really, raided the food bag. They're uncomfortable, but it's not the same immediate surgical emergency as GDV.
Got it. So how do they sort this out quickly?
While veterinarians will rely on laboratory tests, blood work usually, A complete blood count, or CBC, might reveal certain patterns, like signs of stress or dehydration and maybe a low platelet count.
Platelets, okay.
Blood chemistry analysis might show electrolyte imbalances and elevated kidney values, often from dehydration or poor perfusion. And a urinalysis might indicate concentrated urine, again pointing towards dehydration.
But there's one specific lab test that the source really emphasizes as particularly valuable: measuring the plasma lactate concentration. This sounds like a crucial piece of the diagnostic puzzle.
It is, definitely. Measuring lactate levels in the blood can be incredibly informative. It helps assess tissue perfusion, basically, how well oxygen is getting to the tissues.
And specifically for GDV.
Specifically, it can help determine if stomach tissue is undergoing necrosis or death due to lack of blood flow, and it's also a strong predictor of the likely outcome, the prognosis.
Wow. Does the source give numbers on that?
It does, and they're quite striking. Dogs with lactate levels below 6.0 millimole had a remarkably high survival rate of 99% in the study cited.
99%.
But those with levels above 6.0 millimole had a significantly lower survival rate of only 58%.
Only 58%. That's a huge difference.
It really underscores the importance of this measurement in guiding treatment strategies and giving owners a realistic idea of the severity and prognosis.
Okay, so blood tests are key. What about imaging?
Abdominal X-rays are absolutely essential. They are usually the definitive diagnostic tool.
And what are they looking for?
The source highlights a specific finding that's often seen on a right lateral X-ray view that's with the dog lying on its right side. It's called compartmentalization of the stomach, sometimes described as a double bubble or the Popeye arm sign.
Compartmentalization, like the twist creates separate gas pockets.
Exactly. It's a classic and highly suggestive sign of GDV. They also mention that a dorsiventral view, taken from the dog's back looking down, can also be helpful in confirming the diagnosis.
Okay. Any other imaging?
Rarely, they might cautiously attempt a contrast upper GI study where the dog swallows barium, but honestly, due to the high risk of aspiration getting that stuff into the lungs, it's usually avoided if standard X-rays are diagnostic.
Right. Sounds risky.
So all this diagnostic information helps build a clear picture of what's happening internally. And when they do proceed to surgery, the pathologic findings, what they actually see inside, can include that splenic torsion we discussed earlier. As for the stomach itself, it's often markedly swollen, edematous, with signs of vascular congestion, bruising, and tissue damage, which can unfortunately progress to full-blown necrosis if blood supply isn't restored quickly.
This all paints a very serious picture, which brings us to the critical emergency response, the treatment. The source stresses, in no uncertain terms, that GDV is a medical emergency.
Absolutely. Time is critical.
It demands immediate hospitalization and aggressive treatment to combat shock. The initial step is typically fluid therapy, correct?
Absolutely. Stabilizing the patient first is key. Veterinarians might use crystalloid fluid solutions, colloid solutions, or a combination of both, tailored to the individual dog's specific condition and degree of shock.
Big four lines, lots of fluids quickly.
Yes, usually large bore 5E catheters, often in the front legs, cephalic veins, or sometimes the neck, jugular vein, to get large volumes of fluid in fast. The primary goal is stabilizing their cardiovascular system.
And once they're somewhat stabilized, the next crucial step is gastric decompression, relieving the pressure.
Correct. You have to get that trapped gas and fluid out of the stomach.
How do they do that?
The preferred method, according to the source, is orogastric intubation. That involves carefully passing a lubricated tube down the esophagus and into the stomach.
Like pumping the stomach.
Sort of, but it's more about letting the gas and fluid escape out through the tube. However, they note that this can sometimes be challenging, especially if the twist is really tight.
What makes it difficult?
The twisted entrance to the stomach can block the tube. Veterinarians might employ various techniques like using lubrication, gently twisting the tube, repositioning it, or even changing the dog's body position, maybe sitting them up slightly. Sometimes sedatives or medications to relax the esophagus can help.
Okay. And if they can't get the tube down, is there another option?
Yes. If they are unable to pass an orogastric tube, the alternative is percutaneous gastrocentesis.
What's that?
That involves inserting a large needle or catheter directly into the gas-filled stomach through the abdominal wall. They'll carefully tap on the belly to find the area where the gas sounds loudest.
It's like tapping a drum.
Kind of, yeah, finding the area of maximum ping. And you can often hear the audible hiss or release of pressure as the gas escapes through the needle.
Does that work as well?
It helps relieve pressure quickly, but the source points out that it might take a bit of time, maybe multiple attempts, to achieve full decompression this way compared to a well-placed tube.
Okay, but decompression is vital.
Absolutely. But the overarching message here is that following initial stabilization and decompression, surgery is almost always necessary to definitively address the GDV.
So decompression buys time and stabilizes, but surgery fixes it.
Exactly. In very rare instances where the dog's condition is rapidly deteriorating and not responding to initial stabilization efforts, immediate surgery might be the only option, kind of a last resort.
Okay, so what are the primary objectives of that surgical intervention?
The source outlines three main goals. First, to physically reposition the stomach and the spleen, if it's also twisted, back into their correct anatomical locations. Just untwist everything.
That sounds...
Second, to carefully examine these organs, the stomach and spleen, and assess whether the tissue is still viable and healthy or if parts have died off from lack of blood supply.
And third?
And third, and perhaps most vital for long-term survival, to take steps to prevent this from happening again in the future. Because it can happen again.
Right. So how do they assess the tissue, and what happens if it's not healthy?
The surgeon looks at the color, the thickness of the wall, whether there's a pulse in the vessels supplying it. If they find any portions of the stomach or spleen that are clearly non-viable, necrotic.
Dead tissue.
Dead tissue, yes. They may need to surgically remove those parts, performing a partial gastrectomy, removing part of the stomach, or a splenectomy, removing the spleen.
Okay. And how do they prevent it from happening again? That seems crucial.
It absolutely is. To significantly reduce the risk of recurrence, the key procedure is a gastropexy.
Gastropexy, what does that involve?
This involves permanently attaching a portion of the stomach wall, usually the antrum near the exit, to the inside of the body wall, typically on the right side. This tacking procedure prevents the stomach from twisting again.
So it anchors it in place.
Pretty much, yes. The source mentions that there are various surgical techniques for performing a gastropexy, different ways to suture it, and the specific method often depends on the surgeon's preference and the situation. But the goal is the same. Stop the twist.
And what does the postoperative care and recovery period look like? It sounds like there are some important considerations.
There are indeed. Recovery takes time. Activity typically needs to be restricted for a period of about 2 weeks to allow for proper healing of the incision and the gastropexy site.
No running and jumping.
Definitely not. They encourage reintroducing oral food once the dog has recovered sufficiently from surgery and anesthesia, usually starting with small, frequent meals of something easily digestible.
Okay. And the food bowl height thing, does that matter after surgery?
The source touches again on that, reiterating that its role in preventing recurrence after apexy remains unclear. It was more linked to the initial risk. They do suggest considering diets that are restricted in fat, as fat can slow stomach emptying.
Makes sense. What else is important after surgery?
Thorough client education is absolutely vital. Owners of at-risk breeds, especially those who've been through this once, need to be fully informed about monitoring for any issues and understanding the long-term picture.
And what about medications? Antibiotics? Pain relief?
Yes. The source mentions that administering antibiotics around the time of surgery, perioperative antibiotics, is crucial, given the potential for bacterial contamination. Pain management is also critical for recovery.
Are other medications used?
Medications to protect the stomach lining, known as gastric protectants like sucralfate or acid reducers, might also be used to help prevent ulcers, which can be a complication.
Okay. And any drugs to be careful with?
Interestingly, yes. They note some medications that should be used with caution or potentially avoided. Certain synthetic colloid fluids, like hydroxyethyl starch, have fallen out of favor in some critical care settings as they might interfere with blood clotting. And drugs that could significantly lower blood pressure need careful monitoring.
Right, because they've already been in shock.
Exactly. Postoperative follow-up involves careful monitoring pain levels, heart rhythm for those PVCs we talked about, hydration, urine output, and kidney function are all watched closely.
Okay. And when we consider prevention strategies outside of surgical intervention, say,
Yeah.
for a dog at risk who hasn't had GDV yet,
Well, some have more solid evidence behind them than others. Definitely avoiding vigorous exercise immediately after eating or drinking is a generally accepted recommendation. Just common sense, really.
what about eating habits?
Some owners try to slow down their dog's eating, especially the fast eaters. They might use specialized puzzle feeders or bowls designed to make them eat slower, or feed multiple smaller meals throughout the day instead of one or two large ones.
So that no.
It's thought to reduce the amount of air swallowed and prevent rapid distension, so theoretically, yes. As we discussed, the role of elevated food bowls is still debated. The current evidence leans towards not elevating them for at-risk dogs.
Okay. Any other tips?
Some owners choose to soak dry food before feeding, thinking it might expand less in the stomach, although the evidence for its effectiveness in preventing GDV isn't strong. It's more about managing known risk factors.
So even with prompt and appropriate treatment, including surgery and gastropexy, are there potential complications that can still arise?
Unfortunately, yes. The source mentions that even after a successful gastropexy, the stomach can still dilate again, get bloated, although a recurrence of the volvulus, the twisting, is very rare if the pexy was performed correctly and holds.
So bloating possible, twisting unlikely.
Right. Other potential issues include complications if any dead or damaged tissue wasn't completely removed during surgery that could lead to stomach rupture and peritonitis, a severe infection.
That sounds bad.
Very bad. And they can also see post-operative complications such as those heart rhythm problems continuing, blood clotting disorders like DIC flaring up again, and stomach ulcers developing.
So the recovery isn't always straightforward.
It requires careful monitoring. However, the good news is that the source emphasizes that overall mortality rates associated with GDV have significantly decreased over the past few decades.
Why is that?
It's likely due to increased awareness among owners leading to earlier treatment, plus advancements in our understanding, anesthesia, surgical techniques, and critical care.
That's encouraging. What does the prognosis look like now?
If a dog receives appropriate and timely treatment and there is no significant stomach necrosis found during surgery, the prognosis is generally excellent, with a reported survival rate around 98%.
Wow, 98% if caught early and no dead tissue.
Exactly. Even in cases where stomach necrosis is present, requiring removal of part of the stomach, the prognosis is more guarded, but still has a reported survival rate of approximately 66%.
Still better than it used to be, I imagine.
Definitely. Overall, short-term survival combining all cases has been reported around 84% in some studies, but there are factors that worsen the odds.
Like what?
Factors associated with a less favorable prognosis include the presence of low blood pressure when they first arrive at the vet, the development of that clotting disorder DIC, evidence of peritonitis, and needing both the spleen and a portion of the stomach removed during surgery. Those cases are tougher.
Okay. So to really boil down our deep dive into GDV, it's a very serious and complex emergency that primarily affects those large, deep-chested dog breeds. Those smaller, deep-chested dogs aren't entirely immune. Recognizing the early warning signs especially, that non-productive retching and seeking immediate veterinary attention is absolutely paramount for survival. Time is truly of the essence.
Can't stress that enough.
And while the precise cause still remains a bit of a mystery, having a solid understanding of the risk factors breed, chest shape, eating habits, maybe genetics, and the dangerous cascade of events that unfolds once that stomach twists is crucial information for anyone who shares their life with or cares for dogs that are predisposed to this condition.
Exactly. And this brings us to a final thought for you to consider. Given that there's still ongoing uncertainty surrounding the exact triggers for GDV and the continuing discussion, even confusion, around preventative measures like food bowl height,
Yeah.
what specific areas of research do you think hold the most promise for further improving outcomes and ultimately saving more dogs at risk of this life-threatening condition? Where should the focus be next?
That's a great question. It really underscores that even with all the knowledge we've gained, there are still critical questions to be answered to better protect these dogs.
Absolutely.
Definitely something important to think about. Thanks for joining us for this deep dive.